Okay, so I am having a knee scope today to fix a lateral meniscus tear. A little background history on my knee. I had ACL repair in 2003 and medial meniscus repair. It turns out that I now currently have a radial tear in my lateral meniscus and a partial ACL tear. I am leaving the ACL alone, and today we're just going to do a meniscectomy with Central Orthopedics out here on Long Island. But I thought I'd do a cool little experiment and show you guys what it looks like with what happens to the muscle or the quad before and after the surgery. Something as simple as just two little arthroscopic holes can do to the muscle contraction of the quad. So here we go. This is a quad set around 10:30 this morning before surgery. You can see I get decent contraction. You can see the VMO, lateralis, and the rectus all contract pretty well. This is my right knee. This is a quad set pre-operation today. I will do a post immediately following the surgery to show what the quad set looks like immediately post-op. I'll do another one again tonight around 8 p.m. or so, and another one tomorrow morning, just to show what the effects on the body are of surgical intervention and why PT is so important. Okay, so I am back. It is about 3:30 on Friday afternoon. I'm about an hour and a half outside of the recovery. I'm back home, already done ambulatory. Sent me home with crutches. Weight bearing is tolerated, no big deal. But I want to show you guys the effect it had on my quad already. About an hour and a half post-op, see what it looks like. So here we go. So there's the beautiful leg, full of iodine still. I took the ace bandage off a little bit so we can see the quad. That is about the extent to which I can get a quad set. That's all I got. Compared to before, that is markedly different. Almost no quad reaction at all. I will check back in around 6:30, 7 o'clock or so, look at it again, see if there's any change. I'm not going to do any neuro rehab today. I'm just going to keep it rested, elevated. Tomorrow I'm going to start doing some neuro rehab with complex unit, some isometrics, that kind of stuff, get the quad moving quite a bit. So I'll check back in. Okay, so it is 7:15 p.m., about 6 hours post-op now. Quad test starting to come along pretty good. Still really bad compared to, pre-op, but let's take a look. So all in all, not a lot of swelling. Legs feeling pretty good. Definitely a better quad set than 4 hours ago, but still nothing compared to what it was pre-op. And that's what we gotta get working on tomorrow. Not too terrible. Okay, morning after surgery, about 9:15 in the morning. I'm gonna check in on my quad set again, see how it feels, and how we're progressing. Okay, legs looking pretty good still. No real swelling. Quad set is coming along pretty nicely. I'm gonna put some neuro rehab with the complex on it right now. See if we can get this quad to fire a little more. Okay, so using the complex on the resistance setting, trying to get a nice quad set when it comes on. Right now it squeezes. When it's on, I'm on, I squeeze the quad with it, trying to get that neuro re-education back in. Full disclaimer, Complex USA does not recommend that you use their unit for neuro re-education. However, I am a healthcare professional, so I'm comfortable enough doing it. But I do not recommend doing this on your own without the supervision of somebody who knows what they're doing. Okay, it is Monday. I'm officially 3 days post-op lateral meniscectomy, partial meniscectomy. Doing real well. Quad set's coming back real nice. Feeling pretty good. Walking without crutches. Have about 115 degrees of flexion in the knee, so everything's coming back pretty good. Took today off of work, but I head back tomorrow. So let's check out that quad set one last time and see where we're at. Okay, so there's the knee. Doesn't look too swollen. You can see my scar from my ACL surgery from a couple of years ago. And here we go with this quad set. Definitely better than it was Day after, day of, getting some definition back. You can see the VMO firing. Lateralis coming in. Rectus looks pretty good. So all systems go. Start regular rehab tomorrow.